Hello, everyone, and thank you for joining us today for our webcast titled Medicare Open Enrollment Avoiding Critical Mistakes. My name is Jim Holtzman with Legend Financial Advisors and Emerging Wealth, and I will be the presenter today. All attendees are going to be muted during the webcast. And then if you have a question that you want to type in, you can go to the panel box on the right side of the screen, and there will be a section for questions. And you can type those in there, and I will address those questions at the end of the presentation. And then if you have any technical difficulties, you can also use the same questionnaire to submit. And we have folks monitoring this area, and we'll do our best to help you with it. Once I complete the question and answer and you exit, there will be a brief survey. We would appreciate your feedback for today's webcast and also for any potential future webcasts that you would find of interest. So with all of that, let's go ahead and get started as the open enrollment period is coming up. So the first thing we're going to talk about is just what is Medicare, kind of a beginning point. And it's the health insurance program for folks that are 65 years old and up. The Centers for Medicare and Medicaid Services is the group that actually does the administration and the day-to-day work with Medicare. And then if you go through the enrollment process, you actually do that through the Social Security Administration using their website. Now, who's going to be eligible for Medicare? So right now, it's for anybody over the age of 65, which in this case would include all U.S. citizens over 65, and then for any legal residents who've lived in the U.S. continuously for at least 5 years. There is one exception to this, and that has to do with anybody that's under the age of 65, and they're eligible for Social Security disability benefits. All right, this might be the most important slide that we go through if you're not age 65 yet and haven't had to go through this decision. So when you get to age 65, you have two decisions to get your Medicare coverage. You can go the route of what is called Original Medicare, or option two is what is called a Medicare Advantage Plan, oftentimes will be referred to as Part C. So the way this will break down, if you go through Original Medicare, this will be the first section includes Part A for hospital insurance. And as long as you've paid into the system long enough, there is no additional premium for this cost. And then for Medicare Part B, this covers the medical insurance side. And this one does come with the premium. And we'll talk about more about how the premiums are set up and how much they are a little bit later. Now, if you go the Original Medicare route, you're going to also want to get Medicare Part D, which is for Medicare prescription drug coverage. And we'll be talking about all these a little bit more in detail. Now, once you go through those parts, you then want to get what's called a Medigap insurance policy, or sometimes referred to as Medicare Supplement Insurance. And so these are important. This policy is important because it will help cover some of the gaps of Medicare A and B, things like copays and deductibles, and I'll be able to show you other coverages that it will take care of. So over to the second option for Medicare Advantage, this runs more like, I'll call it traditional health insurance, where you'll have an HMO or a PPO option. And with Medicare Advantage, Part C is one of the things you need to be aware of is that it covers Part A, Part B, and almost all the time Part D. So it's all wrapped into one policy. And then it also, you can't get a Medigap policy with Medicare Advantage, but within the Medicare Advantage plan, depending upon the features of the policy, will dictate how much of the gaps of Medicare A and B that it covers. So again, it covers Part A, B, D, and really Medigap coverages can also be included in here. So just taking a step back, two options, Original Medicare and Medicare Advantage. Now we're going to break these down a little bit further. So we're going to talk about Medicare enrollment. And the first part that you want to realize, and this, I'll go through this a couple of times during the presentation, unless you're covered by an employer group health insurance plan that covers 20 or more employees, you have to enroll in Medicare when you turn 65. So then in addition to that, if we kind of reverse part of the sentence, if you are covered by an employer group plan that covers less than 20 or more employees, then you also have to, at that point, enroll into Medicare. So if you're covered by that employer group plan with 20 or more, you don't have to enroll. If you are not, then you have to enroll at age 65. And we'll break down the employer group coverage and how it ties into Medicare very shortly. So what happens if you don't enroll in Medicare on time is that you can have late enrollment penalties. You could also have a situation where you have a gap. You don't have any insurance at all, and you just might be totally exposed to whatever healthcare expenses come up during that time frame. And then if you can find private insurance for anybody that's over the age of 65, most likely the options are going to be much more limited than a Medicare policy or Medicare Advantage plan policy. Oftentimes, most companies won't even provide a health insurance plan after 65 because of Medicare Advantage and Medicare B really are the routes that almost everybody goes. So a little more about how to enroll in Medicare. So if you're receiving Social Security benefits when you turn age 65, then you're automatically enrolled in Parts A and Part B. Now, you can decline Part B if you don't want it, but it will happen automatically unless you inform the Social Security Administration and the Center for Medicare and Medicaid Services. Now, the coverage will start the first of the month that you turn age 65. And then if you're going that Medicare route, Part C, well, I should start by saying Part D, the prescription drug coverage is not automatic. You have to choose between private insurers and proactively go to the company. So on the other side for Part C and Medicare Advantage, it's the same thing. You have to go to the private marketplace in order to get the insurance. So additional information, if you're not receiving Social Security when you turn age 65, then you have to sign up through Social Security Administration during a Medicare enrollment period. Now, there are three different kinds of enrollment periods. The first one is what we will call the initial enrollment period, and that applies if you're not covered by a group plan at age 65. There's also what's called a special enrollment period, and this will apply if you're covered by a group plan at age 65. And again, it has that 20 employee threshold. More than 20 employees, you're covered here. Less than 20 employees, you have to go through the initial enrollment phase. And then the general enrollment period applies if you've missed either of these two enrollment periods. We're going to break all of these down a little bit further. So this is really important to understand with Medicare when your coverage actually starts. So if you sign up before the month you turn age 65, then the coverage will start when you turn 65. If you sign up the month you turn 65, coverage starts the next month. Then if you sign up 1 month after you turn 65, the coverage starts 2 months after you sign up. And then if you sign up 2 or 3 months after you turn 65, the coverage starts 3 months after you sign up. So this is a really important distinction to understand because if you don't have any other options at age 65 and you don't enroll basically in this time frame, then you could have a gap in coverage because maybe you sign up 1 month after you turn 65 and then it's 2 months after you sign up before the coverage begins. So you could have that couple month gap in there without insurance. So now let's talk a little more about Part A. So Part A, during the initial enrollment period. So basically this will apply for just about everyone who turns 65, and that could also include those folks that have a group plan with a company that has greater or 20 or greater employees. In those cases, what I will tell clients to do is go check with the benefits administrator for your company, whoever's administering the plan, to see how you should handle it. They might tell you to go ahead and do the enrollment in Part A because it might have better coverage than the employer plan. One thing you need to be aware of, and this is kind of an odd kind of one-off you have to be aware of is that if you do sign up for Part A and you have an HSA account and a high deductible plan tied to that, you will not be able to make further contributions to the HSA account. It's just an odd rule they put in place. So again, basic to summarize this, if you sign up for Part A, that takes away the ability to contribute to a health savings account. The money you have in the health savings account is fine. You can leave it in there for whenever you need it, invest it, whatever you want to do with it, but no further contributions will come in. So if you're in this kind of a situation and you don't have to enroll in Part A, you can decline it, and that way your group health plan will still be there, and then you can keep contributing to the HSA. So who signs up for Part B during that initial enrollment period? So this will come back to what we talked about before, those who are not covered by a comprehensive employer plan that covers 20 or more employees. Another way to put this, who signs up for Part B? It's going to be those that are not working, self-employed, employed by a company with less than 20 employees. If you're on COBRA, if you're receiving retiree health benefits, or if you're employed by a company whose health plan is less comprehensive than Medicare. So there's a lot to look at there. And, if you're still working, you have that health plan, group health plan, it's less comprehensive, then this might be a better route to go. Now let's talk about who signs up for Medicare Part D during the initial enrollment period. So that'll be for the original Medicare route. So you signed up for Parts A and B, and then you want to get the prescription drug coverage. So you have to sign up when you're first eligible or face enrollment penalties, a late enrollment penalty. So the only exception to that is going to be if you have a plan with drug coverage that's at least as comprehensive as Medicare, and it has to be labeled as what is called creditable coverage. So just something important to look at if you like the plan you're on, you have to make sure it's creditable to be considered for Part D. So then you have two options for getting the Part D coverage. You can get a standalone prescription drug plan if you have gone the original Medicare route. If you've gone to Medicare Advantage plan, almost all of them include drug coverage, so some do not. So it's something you have to check on. But with Medicare Advantage, it kind of wraps all the policies into one. Oops. So the special enrollment period, so that has to do with, again, is if you have not signed up for Medicare Part B and D during the initial enrollment period because you have group coverage. And this also applies to whether it's yourself or your spouse. So if you're not working, but your spouse has a group health insurance plan, the company has 20 or more employees, you're good to go. You qualify on your spouse's plan as currently having coverage, and this special enrollment period applies. So the way this will work for Part B is that this period starts any time before the coverage ends, and then let's say you retire at age 67, so you're 2 years past the beginning point for Medicare. You have an 8-month period starting the month group coverage ends in order to sign up for Medicare B. So the one thing you still have to be careful of is that you want to get the timing right so that you can get a policy in place as quickly as possible. And that's why you can start the process before your coverage ends, because if you know you're retiring in, say, June, you can time it so that you can get the policy set up in time so you don't have a gap in coverage. So for Medicare Part D, it's a little bit different. So you can enroll for this anytime before the coverage ends. And then in this case, you have 63 days after coverage ends to get that in place, as opposed to 8 months with Medicare Part B. So by doing this, you avoid those late enrollment penalties, which is why this is so important to understand. All right, so the best time to enroll in Medicare is during that initial enrollment period or the special enrollment period, because by doing that, you avoid those late enrollment penalties. And then as we talked about with potential gaps in coverage, you want to make sure you sign up for both policies, Medicare B and D, before the current coverage ends, or the Medicare Advantage plan, I should say as well, depending on what route you decide to go. So there's a lot to think about here whenever you're approaching retirement and whether it's before 65 or after 65. It's really a timing issue you want to be really careful of. So now we're going to talk about the general enrollment period. So this applies if you miss the initial enrollment period. The general enrollment period runs from January 1 to March 31. So what's also really important here is that if you sign up during this time frame, your coverage doesn't start until July 1. So again, you got to be careful with those gaps in coverage and recognize that if you just strictly follow this part, you're going to have a gap from April 1 to June 30th, basically. So if you sign up during these months, again, January, February, March, coverage begins on July 1st. So just to kind of summarize, as it gets pretty confusing when you have so many different enrollment periods, we've just summarized here the initial enrollment period, the special enrollment period, and then the general enrollment period. So we've covered all of those, but it's kind of nice at the end to sort of summarize it this way. And so if you go through the slides after the presentation is done, this is a really nice page to keep an eye on and make sure you don't miss any of these periods, whichever one will apply for you. All right, so now we're going to talk about how to sign up for Medicare A and B. And you go to the Social Security website, which is a little bit weird to begin with, but then there's a section on there for applying for Medicare benefits. You can also call Social Security with this number. You might want to at least start things online so you at least have kind of a record or a file set up at that point. And then that's how you actually start the process. And that's if you aren't receiving Social Security already at age 65. So let's talk about Medicare D and how to sign up for that. So this will depend on which route you go, Original Medicare or the Medicare Advantage Plan. So in Original Medicare, you have to shop for coverage. So you're going to go through the private insurance companies, shop for coverage, make sure it's creditable and qualifies for Medicare Part D, and then basically shop as many plans as you want. And there are thousands of plans you can shop with. They'll have different formularies, maybe different co-pays, things like that. But it's really important to spend some time with this so that you're able to cover what prescription drugs you need. Now, if you go to the Medicare Advantage route, then almost all the time, the plan is going to provide drug coverage. So with that, again, you want to shop the different plans that have maybe different formularies, whatever the case is, and making sure you have the coverage that you need. So this part you want to allow some time with to make sure you get a policy that is appropriate. So, oops, okay, I thought I might have skipped a slide. So now let's talk about the coordination of benefits. So if you're 65 or older, you're entitled to Medicare and you're covered by a group plan where the company has 20 or more employees, the group health plan will pay first and Medicare will pay second. So if you have a group health plan and it's less than 20 employees, Medicare pays first and then the group health plan will pay second. Now, if you have a group health plan that has retiree coverage, which we don't see too much anymore, Medicare will pay first, and then the retiree coverage pays second. And then if you're on COBRA, it's Medicare first, COBRA comes in second. All right, so now we're going to do a little bit of a deeper dive into Medicare and private insurance. So here are some of the out-of-pocket costs that you will pay as a Medicare beneficiary. So you're going to have Medicare Part B premiums, and we'll go over what the current premiums are for this. And then you will also have private insurance for Part D, Medicare prescription drug coverage, plus a Medigap policy. Or if you go to the route of Medicare Advantage, you'll have a premium for that policy. Again, one policy for this, and then in this case, you're going to have a Part B premium, Part D, and a Medigap premium to pay. So some of the other out-of-pocket costs that you'll run into will be deductibles. Portions of doctor bills not paid by Medicare, basically the doctor doesn't pay the full, or they charge more than what Medicare covers. and then any services that aren't covered by Medicare. Just some of the same issues that you have to deal with uh, today, even before you get onto Medicare. So now the monthly premiums. So the way this will work for Part A, if you have paid into Social Security for 40 or more quarters, which is 10 years, you don't have to pay anything for Part A. Now, if you have paid in for 30 to 39 quarters, you have to pay a premium of $274 a month. And if you've paid in less than 30 quarters, you have a premium of $499 per month. So then to Medicare, the base premium for everybody starting today or in 2022 is $170.10. Then, if your income is deemed to be too high, you will have what's called an income related adjustment, or as I just call it, a surcharge, that will be on top of this premium. And we'll get into that a little more detail in, I think, the next slide. Then for Part D, you're paid this again to a private insurance company. It's going to vary by the plan. And there is also another income related adjustment or surcharge if your income levels are deemed to be too high. And I would say the average, at least that I use with our clients' retirement projections, I put in $40 a month for this. And most times the premiums come in lower. Actually, I don't think I've ever seen one greater than 40 a month, but I'm sure there are plans out there that do go that high. So if anybody's looked into Medicare B and D and you've heard about these income related adjustment amounts, you oftentimes will see this chart, which is very noisy, but I'm going to cover two rows of this to hopefully give a better understanding. And the way you want to look at the columns, I'll go over this first. MAGI stands for Modified Adjusted Gross Income. So you look on your tax return, and most of the time, the adjusted gross income that is reported on the tax return is going to be your modified AGI. And so you have modified the MAGI for single, MAGI for joint, MAGI if you're married filing separately. Then you have that Part B base premium, which we talked about in the last slide, of $170.10. In this scenario, this assumes that your income is less than these thresholds. And over here for married filing separately. So in that case, you don't pay anything additional beyond this premium number. Then you have to pay the Part D monthly premium. So again, the average we're assuming is $40 per month. And again, because your income modified AGI is less than these thresholds, there's no surcharge to worry about. But in this column, we're just summing up these numbers right here, and that totals $210.10. So I'll go to the other extreme, and we'll look at the very bottom. We're talking about some really high income levels here. So if your MAGI is 500,000 or greater, for joint 750,000 and greater, married filing separately 409,000 and greater. Here's the way this will work. So your base premium is still the $170.10. Now you also have a surcharge of $408.20. The Part D average premium just stays the same at $40, but then you have the surcharge for Medicare D, which would be $77.90. Those four add up to $696.20. So if you compare that from kind of the baseline, if you will, with no income adjustments, you're dealing with over a 3 times increase. Now, this is a really high income threshold. So the way you want to read the rest of this is you take a look at where your AGI is, and then you can see where you fall in. So a couple of other points as you go through this, you'll see in this column, the base stays the same. In this column, you can see how the surcharge goes up as your income levels go up. Part D, you've got the $40 a month as the base, and then the surcharge, you can see again, it increases as your income gets higher. So the other thing that's important to note is that when this gets assessed, let's say you're completed 2021's tax return, you have your MAGI, Modified Adjusted Gross Income, that impacts your premium 2 years later. So if 2021 return is filed, that would impact your premium in 2023. So there's a 2-year lag before the surcharge actually hits. As a result of this, doing income tax planning can be really important if you're sort of straddling between one level to the next. There might be some moves you can make to stay in the current level that you're in, maybe even eliminate or go to the lower level from there and save yourself some premium dollars. So it's just every situation will be different, but you might have options, maybe selling capital losses, maybe deferring gains to a following year. It just depends on your situation. Um, and if you're taking required minimum distributions, there's an option for what's called a qualified charitable distribution, which is where you take the required distribution and gift it to charity directly. So if you had, let's say, your required minimum distribution, which you have to start taking from retirement accounts at age 72, let's just say it was $50,000, and you annually gift, let's just say $10,000 to charity, you can have that go directly from your RMD and reduce your taxable income and your adjusted gross income by that $10,000 number. So the entire $50,000 would be taxable, but if you do 10,000 of qualified charitable distributions, the taxable amount would be 40, the 50,000 minus the 10,000. So there's a handful of ways at least that you can try to control your income bracket for this purpose and maybe keep your premiums from jumping to the next level. All right, so we're going to talk about what some of those actual out-of-pocket costs are. So the deductibles you pay for Part A is $1,556 per spell of illness. For Part B, it is $233 for the deductible, and then it's waived for more preventive type medical screenings, annual doctor visits, flu shots, things like that. You don't have to worry about this. And then for Part D, the deductible is $480 per year. So with the deductible, these amounts are what you have to pay dollar for dollar out of your own pocket before the insurance starts to kick in. So then we go to the coinsurance component. So with Part A, the hospital coinsurance is $389, and that covers from days 61 through 90 in a hospital. Then it jumps to $778 for days 91 through 50. And then there is a skilled nursing component to Part A that has the coinsurance of $194.50, and that covers you for days 21 through 100. So oftentimes I'll get the question, is long-term care covered by Medicare? The best way to think about it is no, but you do have some coverage in skilled nursing right here, but that's it. So over to Part B, so assigned claims, which 20% it will cover of the Medicare approved rate is what you have to pay. And then unassigned claims are 20% of that approved rate plus the balance of the actual charge up to an additional 15% of the approved charge. So again, this has to deal with where maybe a doctor charges more than what Medicare covers. That's what this unassigned claim really deals with. And again, so this is the formula to calculate how much you could have to pay or you could pay. Now, Part D coinsurance is a whole other type of calculation. So the deductible is $480, which we covered before. Then you have to pay 25% of the drug costs after this deductible has been paid. And then there is a small copayment once your out-of-pocket spending has reached $7,050. So this is kind of the maximum exposure you have, plus a small copayment after that point. And that'll just depend on the details of your policy. Then as it mentions here, drug plans can vary widely because you're going to the private market. So you're just going to have to really dig into the details and try to find the best fit. But this gets expensive. And all these various deductibles, copays, they will inflate a little bit each year. So you just have to be aware of that as well. So what Medicare covers, it covers, and this is where you don't have to pay anything. For the hospital coverage, it pays 100% of the first 60 days, which makes sense because the other timeframes it outlined pick up above and beyond this. For medical services, it pays 80% of the Medicare approved amount, which is why you're subject to the 20%. And then preventive services, again, flu shots, screenings, not all screenings, so you have to check this first. You won't have to pay anything for that. Another really good resource is right here at the bottom. There's a booklet called Medicare and You, and you can go to the Medicare website and find that. You can also order it as well. And it's a pretty big booklet. I think it's about 100 pages, and it's pretty user friendly in terms of the way it describes Medicare. It sort of takes it a step further than what I'm doing on this webcast. A lot of really good information is in that booklet. So now, what Medicare does not cover. So it doesn't cover long-term care outside of that small period for the skilled nursing care. It doesn't deal with any care delivered outside the U.S. It doesn't cover dental care, vision care, hearing aids, cosmetic surgery, acupuncture, or any other alternative cares, amounts that are over the Medicare approved amount, and then it doesn't cover the amounts not covered by deductibles and the coinsurance. So now at that point, we'll go to the next slide. So what private insurance may cover in full and in part. So the deductibles and coinsurance amounts, like that Part A deductible that you're subject to, if you get the Medigap policy, there's options where it will cover the Medicare Part A. Actually, I think all of the plans cover that. Those hospital costs after 60 days where the coinsurance kicks in, you can get a Medigap policy that will cover that. There's an option, or I think a couple of options, where it will cover that 20% of the doctor bills that the Medicare won't pay, and then the amounts the doctor charges over the Medicare approved amount. We'll get into that detail in just a second, but there are ways to solve that problem. For prescription drugs, it doesn't cover, or it may cover, the deductible. And again, this is on the private side. And then most of the cost of drugs during that initial and benefit period, and then what they call the catastrophic coverage period, which is where you're subject to most of the costs. Now we're going to talk about ways to solve those problems. So we'll start talking about Medigap. So this is what you would get if you go that original Medicare route. So you have to go to the private market. Private insurance companies will sell the policies. And the idea, again, is to supplement Parts A and B. And then there are federal and state laws that keep some of this standardized. And basically, a Medigap policy, and there's different options. The options will be the same no matter where you are, but the premiums will be different based on where you are or where you live. So with Medigap, they are standardized. So then if you've ever seen the chart, which I do have, I think in the next slide, they break it down by letters. And then if you're in Massachusetts, Minnesota, and Wisconsin, there are some differences. A key thing to understand is that Medigap does not work with Medicare Advantage. So again, you have the decision to make at the very beginning of getting Medicare, which is where Medigap applies. And then you have Medicare Advantage plan as a separate route to get Medicare. So you can't have both policies. You will pay a monthly premium, and then those costs do vary based on the plan, really the company and the location, and what they charge for it. So here's the chart. I'm going to see if I can increase this a little bit. Oh, too much. Let me try one. No, we'll have to just deal with we'll just have to deal with this size. So you will notice across the top there is Medicare A, B, C, D, and it skips E, which I'll explain in a second, goes to F, G, K, L, M, N. So you see gaps in the alphabet. These are plans that are no longer offered and just don't apply anymore, which is why it doesn't show up here. So the way you want to read this, so here's your Medicare Part A coinsurance and hospital costs up to an additional 365 days after the Medicare benefits are used up. Each one of the policies cover that. So when you see the 100%, that means it fully covers whatever the benefit is in this column. We start to see differences on the Medicare B coinsurance or copayment. All of the policies covered 100% except for plans K, which covers it at 50%, and Plan L at 75%. And then, just as a refresher, we have the slide that we covered before that shows those dollar amounts. And then basically that's how you read the chart. So you have the first 3 pints of blood. You have Part A hospice care insurance or copayment, the skilled nursing facility coinsurance it covers, the Medicare A deductible, Medicare B deductible, Medicare B excess charges, and then also foreign travel emergency. So this could be a really important one if you plan on doing travel overseas or internationally. And then you can see some where there's a blank or nothing in the box. There's no coverage at all. And then you can see of the plans that offer the foreign travel, it's only up to 80%. So another way to look at this is that, well, what's the most comprehensive plan? Well, it's going to be Plan F because you've got 100% across the board until you get down to the foreign travel. And then Part G or G is probably that, and Part C then are the most next comprehensive. But they cover different issues, but there's one part that they don't cover at all. And that gives you an idea of the most comprehensive plans. Then, of course, you have less comprehensive here. And as you probably can imagine, the more comprehensive, the more expensive the plans can get. Now, there are a couple of footnotes down below. Is that this started in 2020. So Plan C and F, of course, are not available to people new to Medicare. If you've already been in Medicare and you have these plans, Part F and C, then you're still covered with those. You don't lose that coverage. So for new enrollees, the most comprehensive plan is Part G. So for enrollees before 2020, if you have Plan F, probably should keep it, because once you move from it, you can't go back to it, because then you're considered a new enrollee into those plans. Couple of other points is that for plans K and L, what you can also do is that you have higher deductible plans, and these are the higher deductible plan options that you can choose. You're not locked into this, and then that's a way for you to control your premium. So the higher deductible, the lower the premium. And then Plan N, there's just a note that it pays for the Part B insurance, except for some co-payments. So the best way to do this is really assess your needs, go back and see what the various costs are for these, understand how much exposure you have, and then compare it to the premiums that you're able to get. And this does change, as you can see in 2020, that C and F plans are no longer available for new enrollees. So this is a moving target. This gets updated every year, so you just have to be careful of that. So a little bit about Medicare Advantage plans, and I probably have about maybe 5 to 10 minutes left, just as a heads up for anybody that's on a deadline time-wise. So for Medicare Advantage plans, so these will be, Medicare has to approve them. We know they're called Part C. We know private insurance you have to go to get the policies. And the way it works kind of behind the scenes, Medicare pays the amount for each member's care. So they have an arrangement worked out with the Medicare Advantage plans. And then, as I mentioned at the very beginning, Medicare Advantage plans work like, I'll call it traditional health insurance, where you might have to use network doctors or hospitals. Most of the time, the plan will include prescription drug coverage. And then what's also nice about Medicare Advantage is that some of them include extra benefits like vision or dental. And then some benefits and cost sharing may be different. So let's take a step back, compare Medicare and Medicare Advantage again. The one thing you have to recognize, because Medicare Advantage looks pretty attractive, it's all in one. You might have vision and dental coverage. Even some of them throw in gym memberships into their plans. However, with every positive, there has to be something to consider, and it is the following. If you get Medicare and you're traveling around, just say the United States, and something happens where you have to see a doctor, you're almost definitely going to be able to find a Medicare doctor in most cities, probably all cities, and most likely smaller towns as well. With Medicare Advantage plans, because you have to be careful about the network doctors in hospitals, if you get a more localized Medicare Advantage plan, and I'll give an example for those that live in the Pittsburgh area. We have University of Pittsburgh Medical Center. They offer Medicare Advantage plans because they have a health insurance division, but their network doesn't reach around the whole country. So if you're traveling, say to California, and there's no UPMC health insurance coverage, then you're going to have to go out of network, which is where additional costs can come into play. Now, a way to get around that is if you use a nationwide plan like a United Health Insurance. They're a nationwide plan, and you're going to be able to most likely find a doctor, hospital, whatever the case is, where you'll be able to use the coverage because they cover all states. So another option is if you go with a health insurance that is part of the Blues network. I think they cover 37 or 38 states, so it's not all of them. But those are some ways to avoid the regional health insurance issue to be uh, aware of. So when you're shopping for the policy, since you're going to the private marketplace, you just still want to make sure you're doing the shopping because of the various cost differences. So while Medigap policies are standardized, when I say standardized, that's all of those different letters. The coverages are the same. You have to, again, you're making the choice based on these letters, whatever one best applies to you. You obviously want to go to a reputable company that's giving you the best price. And then another important factor is making sure your healthcare provider processes the billing for the company that you choose. Drug plans, again, same thing. You want to go with a reputable company, go through the formulary to make sure your medicines are covered. And then with Medicare Advantage, it'll be all over the board again in this case because of the fact that it's a private insurance company. All right, the last couple of slides, I'm just going to talk about, give you some idea of the cost that you can run into. So with original Medicare, put an average in of $200 per month. And if you get the best coverage, I always use an assumption of $300 a month to be safe in that regard. With the Medicare Part D, you have the average of being $40 per month, which we talked about before. And then with Medicare Advantage, the premiums can be quite low, the average being $50 per month, because you can control the deductibles. Raising the deductible lowers the cost. The one thing you have to recognize with the Medicare Advantage, you still have to pay the Medicare Part B premium on top of this number, but this strictly applies to the plan itself. So out-of-pocket costs, co-payments, we talked about before for drugs and doctor visits. Payment for non-covered services, you're going to be out of pocket for that unless you go the route of the Medicare Advantage plan and maybe they have all of these all wrapped into one. And here's a sample budget. So you have the Medicare Part B. This premium number is going to be if you enroll today. And then you have the Medigap policy. We'll go with the $200 a month. Prescription drug plan at $40 a month. So the premiums alone will add up to $410.10 based on these assumptions. This one is locked in and set in stone unless you have too much income where you have to pay that surcharge. Then we go from here, we take the $410.10 per month, multiply that by 12 months. That results in an annual premium of $4,921.20. And then just to give an idea of some other out-of-pocket costs, prescription drugs, maybe $650, dental out-of-pocket $450, vision out-of-pocket $300, alternative care out-of-pocket. And these are just assumptions to give you an idea that you still will have out-of-pocket costs. So when you add all of that up, the annual number is $6,521.20. And obviously this is going to vary depending on the details of the plans that you purchase. So with that, that's a lot of information. This is definitely a presentation where you should download the slides and go through it again. We will send out the webcast again, so it'll be recorded. You can listen to it whenever you want. Maybe go to the slides at that point as well. All right. So with that, I'm gonna just take a second and go through the questions and address those. So the first question is just confirming the automatic enrollment. So for the question is, I'm currently on early Social Security at age 64. And so when this individual turns 65, you'll automatically be enrolled for Part A and Part B. And then you want to follow those initial enrollment periods on the slides that I covered before for Part D, or if you go the route of Part C. So just as a refresher, because if you get this part understood, it helps with everything else. So you have the two choices: Original Medicare, Part A, B, D, and Medigap, and then you have Medicare Advantage separately. So there will be the automatic enrollment period. Okay. So next one is really a comment, which is interesting. If you're not collecting Social Security, you'll have to pay Part B quarterly, and monthly is not an option. I wasn't aware of that. So just something you have to be certainly aware of and make sure you have the premiums paid on time. But it is apparently done on a quarterly basis. So I appreciate that information, as I definitely was not aware of that one. And just another point, a question about the inflation, what to assume in those cases. Historically, if you were to average out since, say, the year 2000, Medicare B, the average increase in premium, it's averaged to around 11 to 13% per year. If you go back further, it drops into single digits. So if you're setting up your budget for future years, the premium itself, that's a good way to at least plan conservatively, is go at the higher end, and the averages will have worked out to be that. And then there's some years where it's been very low whenever inflation hasn't been very high. So just something else to be aware of when we put together projections for clients. We go with a higher inflation rate for medical insurance because of that, and it's one of the biggest expenses you have to deal with in retirement. So we try to be conservative along that front, using some of the historical numbers to base the premium off of. Okay. I'll wait and see if there are any other questions. It's one of those things where as soon as you get off the webcast, you're going to think of probably a couple of those. And if that happens, feel free to reach out to us. We can set up a call to discuss those questions. One of the other things we do for our clients is that when they get to this point and they need some further guidance, from our end, we kind of quarterback the understanding of the process, which is what I covered in this. But then you get into the details, the formularies, the type of plan that you want to select, if it's Medigap, or if you go the Medicare Advantage route, or you need to get the Medicare Part D. So we have a number of health insurance brokers that we have worked with, and we can provide you contact information for those folks, and they can help you get into the details more and help you get an appropriate policy. Another question is regard to underwriting concerns. So if you get into Medicare Advantage, Medicare B, Medicare D, Medigap during their respective initial enrollment periods, you do not have to get medical underwriting. However, you have to recognize that after that, if you want to switch, say, Medigap plans, if you want to switch to a different Medicare Advantage plan, you can do that. But most likely, you're going to be subject to underwriting, which will, of course, impact the premium. So you want to make a really good decision during the initial enrollment period, understanding that you can make changes down the road, but then recognizing that you have to be aware of medical underwriting as you go through that process. All right, I'll just wait about 20 more seconds to see if there's any other questions that come up. And it looks like that's going to do it. So again, if you have any questions and want to go through your situation, feel free to reach out to us. Our office phone number is 412-635-9210. And then as you exit, there will be a brief survey when you exit. So again, we would appreciate your feedback. And also, if you have any suggestions about a future webcast that would be really helpful, we would appreciate that as well. And then one last question did come through about what is underwriting. So that's going to be health insurance underwriting that you have to go through for if you want to switch after that initial enrollment period. And another question is, when will the slides be available? So if you go to on the panel on the right, you will have the ability to, there's a section called handouts. You could actually download that PDF right directly from there. Or if you want to wait till we send out the replay, and we'll do that by email with a link, you can do that as well. But you have the option if you want to download the PDF version right now. Okay, so we have another question regarding the coinsurance, the difference between coinsurance and copayment. So those, the seems like in this case that's going to be, they're going to be the same, where you're going to be responsible for part of the cost, and the health insurance company will be they'll be responsible for the other piece. So you might be responsible for 20% of the cost, and then just say Medicare picks up the other 80%. And then on the deductible side, that's where you're out of pocket up to whatever those amounts are. 100% you have to pay of those costs. Excuse me. And I'll just wait a few more seconds if there's any other questions. Okay, I think that should do it. So again, we would appreciate the feedback on the survey when you exit, and feel free to reach out to us with any questions. Thank you so much for your time for attending today.